All right, good morning. I'm Judd Mellinger Block. This is the next in our series of interviews with community health center physicians and other providers and practitioners. I'm here today with Dr. George Garrow, the Chief Medical Officer at Primary Health Network based out of Sharon and spreading across a good bit of the United States, not the United States, just Pennsylvania, to as far east as Schuylkill County. Dr. Garrow he graduated from University of Pennsylvania and did his medical school at Penn State University in Hershey, then did his residency at Presbyterian St. Luke's in Denver, Colorado, came back to Nashville, Tennessee, and did his fellowship in hematology and oncology at Vanderbilt University. Practiced in a couple different places on faculty in Rochester, New York. And before coming back to the northeast part of Pennsylvania, was Chief Medical Officer at a health system in Cumberland, Maryland. And Dr. Garrow, I believe you've been at Primary Health Network for 6 years, 5 years.
Yeah, I'm in my 6th year, yeah.
Okay, very good. So he's married and has 2 daughters, lives on a farm just outside of Sharon, somewhere up in Mercer County, I guess, that area. And so, Dr. Garrow, welcome. Good to have you here.
Yeah, thank you, Judd. It's really great to see you again, and thanks for the opportunity.
You bet, you bet. So tell us a little bit about your background, where you grew up and, what kind of family influences you had or other influences you had that led you to a career in healthcare.
Yeah, thanks. I actually was born in a small town. I live in a small town. I'm probably going to die in a small town. Sound familiar? I actually grew up in Uniontown, Pennsylvania, in Fayette County. Very fortunate. I won the birth lottery. I was born into an extremely loving and supportive family. I'm the youngest child. I had 3 older sisters. I was the first in my family to go to college. Was very fortunate to attend the University of Pennsylvania. I grew up, as I said, in a very rural location, and my education at Penn was outstanding. I mean, not only academically, but living in an urban setting in West Philadelphia in the late 1970s was an education of itself. I since I was an infant, was going to be a physician. I still have a picture at home of me in my crib with a sign overhead that said, "Our son, the doctor." It was always an expectation that I was going to be a physician, and I no regrets. I appreciate the love and the support of my family throughout my whole journey through medical school and residency, and to me it has been a calling. It's not a job. It really is a calling, and I am so grateful for all of the patients and their families that have taught me so much along the way.
So that's great. I haven't heard the story about the sign over your crib. So what led you to get into hematology oncology? What led you down that road?
Yeah, so when I was in my first year of medical school, my oldest sister, Patty, was diagnosed with cancer. And it really opened my eyes to what we could do better from a compassion and humanistic standpoint. Unfortunately, she succumbed to her cancer. But I bring a little bit of her with me to work every day, even now. She was a beautiful person, funny, loved life. And I think of her every day. And I'm just so grateful that she was part of my life. And that's what led me to go into medical oncology.
Wow. That's a very personal story there. Thank you for sharing that. Really appreciate that. So what kind of barriers and did you have to overcome? And it sounds like you had so many positive influences that maybe barriers weren't a big part of your, of you know, of your journey to become a physician.
Actually, in many ways, I really do think I have been very blessed, and a lot of things bounced in my direction. Not having had anyone else in my family that had even gone to college represented a barrier. I remember my early, I think it was my first semester at Penn, and I had a great public high school education, but was really like, wow, how do I, calculus was really throwing me for a loop. And I went and I talked to my professor at Penn, and I said, this is not anything that I was prepared for, even though I graduated top of my class at high school. And he talked to me for a while, and he said, where you have come from, he goes, you don't belong here.
Oh.
And I used that as motivation. I thought, yes, I do belong here. And so I worked really hard, and I think I got an A in calculus. I just want to say, don't tell me I can't do something, because I'm going to do it. I think, in medical school, again, it was tough. Medical school's hard. Residency was hard. Living away from all I had ever known was Pennsylvania, living in Colorado. I met my wife in medical school, and we did our residencies together, so far away from our family. That was hard. But in the grand scheme of things, the challenges and the barriers that I've had to face are nothing compared to what my patients face, to what others in our community have to face. And that's partly, Judd, why I'm at a community health center, is that I want to give to others that maybe haven't had the advantages in their life that I have had.
Right. Well, that's great. And so, you were a chief medical officer at a health system in Cumberland, and then you came there. Tell me about why work as a chief medical officer is where you want and need to be right now in your career.
Yeah, I love being an oncologist. There's something, every physician who has experienced the honor, and it is an honor to be part of someone's life, particularly with oncology at a really delicate time in their life and their family. I opted to get into administration as a chief medical officer because I really felt that physicians should have a seat at the table when it comes to talking about direction of healthcare delivery. I think physician leadership and healthcare organizations make them better organizations. And I really wanted to be able to have physicians have a voice and providers to have a voice in how we deliver healthcare. And so I'm having a blast. This is the best job I've ever had, working at Primary Health Network, working at a community health center. I miss patient care, obviously, but I love being able to assure that everyone has access to high quality care.
That's great. So moving from a health system to a community health center, what surprised you about, if anything, what caught you a little off guard, or what interested you, what amazed you even about working in a community health center setting?
Yeah, I'm embarrassed to say that I used to think that it was the clinic, which, when I did my residence, that's what it was called. And that's what people said, how they said it, the clinic. And, it's like, that's where you go to the clinic. Well, I'm here, to my surprise, when I got here, wow, I would hold up our quality of care to any place I have ever worked, including some pretty highfalutin academic centers that you mentioned earlier, right? That we have some outstanding providers. We do some great work. That was a really pleasant surprise, I think. And just knowing that we're have the ability to really make an impact in people's lives, that maybe haven't had people really take the time to get to know them as people.
Right.
So that has been the best surprise to my mind about working at an FQHC.
That's great. I want to follow that up in just a second with, what would you say to medical students, residents who are thinking about careers and that kind of thing. But I want to start off I want to go back to something you said earlier about that your professor at Penn telling you you don't belong there. And I would bet that there's a lot of kids in rural areas who get that same message. And what would you, if you go back and give 16 or 17-year-old George Garrow some advice, some other, thinking about other kids who are high achievers in the rural or small town high schools, what kind of advice would you give them as they're looking toward maybe a career in healthcare or even a career in some other profession?
Yeah, I actually, my father gave me a pocket watch, when I graduated from medical school. And the inscription on it, and others have, he didn't make this statement, I'm sure I've seen it elsewhere. It said, "Hold fast to your dreams, for through them you can fly." Wow. And don't give up your dreams. And absolutely, no matter where you come from, you deserve to be there.
Wow.
I actually think I actually had some advantages over kids that went to prep schools and academies and stuff, because you know what? I did it on my own, right?
Yeah.
And my mom couldn't help me with my homework because she wasn't even a high school grad, right? I had to learn it on my own. And so for 16, 17-year-old George Garrow, don't give up on your dreams.
Right.
You can do it. You deserve to be there.
So now George Garrow or whoever has gone through medical school or is like finishing medical school and hopefully looking toward a career in primary care or in direct patient care of some kind, or doing their residency in family medicine or peds or something like that. What would you tell them about working in a community health center? What would you tell them, to set them either what would you tell them about working in a community health center?
Yeah, at the end of the day, when you're walking to the car for your drive home, what are you going to think about? And working at a community health center, when I walk to the car, wow, I'm thinking about, look what we did today, and look at the lives that we have touched. And I've been in big academic centers, as you know. I've been in all different types of practice settings, and
Sure.
Walk into the car, and what I'm reflecting on what I did that day is different. Working at a health center, it's very much about the people, the relationships, the lives and the families that I've been honored to touch and to be part of their lives. It's incredible. It's just an incredible feeling.
That's great. I could ask more questions, but I think that's a great place for me to stop asking questions and ask you if you have anything else you'd want to add about, life at Primary Health Network, life in a FQHC, and anything else you'd want to that we missed that you'd like to add.
Yeah, for those of us who were called into service in healthcare, I reflect on what has what we have just gone through and are continuing to go through with COVID, and it's been a stressful time for everyone, no question about it. But Judd, if you don't mind, I'm just going to tell you a story.
Yeah.
About a year or so ago, at the very beginning of the pandemic, a couple of months into the pandemic in 2020, Primary Health Network was invited to come to one of our rural counties by the health department to do testing in the community. And this is at a time that we were moving from red to yellow, and they needed some data to know what the prevalence in the community was. And this particular rural community that we were asked to come and do testing on, and I went and grabbed one of the nurses that I work with so we could do the testing. And they had asked us to test. Maybe 50 people were going to show up. It was just voluntary. It was just for surveillance testing. And this was around the time that the social unrest was happening in our country in 2020. And the community that we serve was a largely BIPOC and immigrant community.
Right.
And so we got there, we set up our mobile unit, and we're ready to start testing. And I come out of the mobile unit expecting to test maybe 50 people that day. And there were over 250 people from this rural community had come out to volunteer to be tested to help us get our hands around COVID. And I looked out and I saw folks of all, ethnicities and demographics lined up. Mm-hmm. And it occurred to me that they love their families every bit as much as I love mine, and they are no different than I am. And we are all so much alike. We are all together. And one elderly woman in particular was an immigrant from Nepal. And so she sat down in the chair, and she was beautiful. She had her garb on, and, was just really dressed. It was really cool. And so I did her swab, way up in. And as I was pulling the swab out, she grabbed my hand. And I said, no. I said, don't worry. Don't worry. We're done. And she nodded her head, no. And she took my hand and she kissed my hand. And I looked in her eyes and I realized there's kindness everywhere. You just have to be open to it. And I have carried that memory with me ever since that time. That was a real gift she gave to me. And, for individuals, for prospective physicians, clinicians that are looking to go into practice, there is no money in the world that's going to feel as good as someone doing that. And I am so grateful for the opportunity to do work like that every day. I am over the moon grateful to be part of a community health center in a rural part of Pennsylvania. Couldn't be happier.
George, you hit it out of the ballpark on that one. That was a great story. Thank you so much. And thank you so much for all you're doing at Primary Health Network, that whole great group of people you have up there in Sharon and elsewhere. And it's an honor to work with you and to serve you folks here at PAC. So thanks so much, and keep up the great work.
Thank you, Judd. Thank you. You too.
Thank you.